In Chapter 14, we're going to be looking at psychological disorders. We will start with the disorder of schizophrenia. We're going to look at the role of genes and environment. We're going to see that both are important. We're going to also take a look at the understanding of what is going on in the brain with regards to, say, neurotransmitter levels in the case of schizophrenia, as well as how the brain is functioning and some differences in brain structure and activity between people with schizophrenia and those without. So let's take a look at some of the characteristics of schizophrenia. As you saw, and if you read in your book, men show the symptoms during their teens and 20s, and it's a little bit later for women, so about a decade later for women. Now let's talk a little bit to distinguish between acute and chronic onset. And acute onset refers to a sudden appearance of symptoms where in the past the person did not seem to show any particular symptoms that were somewhat consistent with schizophrenia. So they never showed, say, for example, an inappropriate emotional affect or a lack of affect, or otherwise unusual reactions to situations, to emotional situations. Acute onset is usually associated with better recovery. Chronic refers to when the symptoms seem to have developed gradually, have been part of the person's personality for quite a long time. So there's a history of inappropriate emotional reactions or very low emotional affect. And chronic onset suggests that the outlook is not as good in terms of recovery. Now, you probably also have heard of positive symptoms and negative symptoms. These are not positive and negative in terms of are they good or bad, but positive symptoms is essentially like too much of something, and negative symptoms is sort of a loss in the behavioral repertoire. The track record in terms of treatment has been traditionally that positive symptoms are more readily treated with drug therapy than negative symptoms, but we'll take a look at that a little bit more closely. Schizophrenia is often characterized as type 1 or type 2 based on the presence of positive or negative type symptoms. So we can see here type 1 what the symptoms kind of look like. So delusions, hallucinations. The response to therapeutic drugs is fairly good. The symptoms are potentially reversible. Intellectual impairment is usually absent, and the underlying dopaminergic activity is thought to be increased. So there's expected to be an increased level of activity at these dopamine receptors in the brain. In contrast, type 2 is associated more with these negative symptoms. So poverty of speech, lack of affect. Here, the response to antipsychotic medications is worse, so a poor outlook there. Symptom outcome is typically irreversible. Intellectual impairment may be present, and the brain, in the case of negative symptoms, seems to show greater loss of brain tissue, so there's definitely cell loss in the temporal lobes. The prognosis and probability, again, does seem to be affected by a number of factors. So good prospects for recovery include a late or sudden onset of the disease as opposed to chronic. Being female has a better outlook. Relatively good pre-illness functioning, in other words, it's kind of an acute bout of schizophrenia as opposed to chronic, where there's minimal cognitive impairment, that's better. And again, more of these positive symptoms and so on. And an unfavorable outlook is correlated with the earlier age at the start of the illness, poor pre-illness functioning, a family history of schizophrenia, and more of the negative symptoms. Now we look at the role of genetics. We're going to be doing this for all the conditions that we look at in this chapter. We're going to definitely be looking at the role of genetics. We see with schizophrenia that there is definitely a higher incidence among relatives of people with schizophrenia. The heritability is estimated to be between 0.6 and 0.9. That's really pretty high. Identical twins are 3 times as likely as fraternal twins to both have schizophrenia. So let's take a look and what we're looking at here. So if we start looking at fraternal twins, their genetic relatedness is 50%, right? And we can see that if one fraternal twin has schizophrenia, in 17% of those cases, the other twin will also have schizophrenia. But that rate goes up to 48% when the twins are identical and share 100% of their genetic material. So we can see that the rate triples. And so that's an indication that there's quite a high level of heritability. However, given that these individuals are 100% genetically identical, we don't see a 100% concordance rate, right? So that tells us that there's more going on with schizophrenia than just genetics. So environment is going to certainly be a factor. Another way to look at the role of genetics is that it doesn't really matter whether a parent has schizophrenia or not. What matters is, does that parent carry the genes for schizophrenia? So where we have discordant identical twins, so let's take a look here. We have discordant identical twins where one individual has schizophrenia and their twin does not. What we find is that their offspring, so these individuals have children, their offspring are equally likely to develop schizophrenia, regardless of whether they're the offspring of the parent without schizophrenia or the parent with schizophrenia. So the presence of the condition does not predispose or create a higher predisposition for their offspring to have schizophrenia. What's important here is the genetic inheritance that the children are receiving. Now, we know then that genes are important because of identical twins having a higher concordance rate than fraternal twins. We also know that genes are important because where there are discordant identical twins, one with schizophrenia and the other one without, and then they have children, that next generation is equally likely to develop schizophrenia at a higher rate because of that genetic predisposition, not because of the presence of schizophrenia in one of the parents. It's that genetic inheritance. And yet, we know that the environment is also going to be important. Why? Because identical twins are 100% identical in their genetic material, and yet we don't see 100% concordance rate, telling us that the environment is going to be important. And so we're going to take a look at, again, the gene and environment interactions that we can trace to and look at in terms of schizophrenia. That brings us to the vulnerability model, and the idea is that there's some threshold of causal forces that must be exceeded in order for the illness to occur. And so your genetic predisposition alone is not enough for the condition to develop. We need to have these forces, these environmental factors that are going to challenge the individual and create epigenetic changes potentially that are going to trigger the development of the condition. And so we're seeing that epigenetics here is going to be certainly a factor, and we'll take a look at that. One way that this works is by upregulating and downregulating gene function among vulnerable individuals. And so the idea is that in those twins, for example, identical twins where both have the genetic predisposition for schizophrenia, some environmental factors are upregulating or downregulating particular genes that are involved that create this predisposition, and that's triggering the development of the condition in some twins but not others.